Hello, everyone. Welcome to another episode of the Menopause Symposium. Today, we are talking about a very important topic, which is the incidence and risk of autoimmune disease among women with POI or premature ovarian insufficiency. Vikram, this is in your clinical experience, is this a common situation? Do you see more prevalent autoimmune disease in this group of women?
Yes, certainly. So over the years, we've found that other than the genetic causes, which might be around 10%, you do find 10 to 15% individuals who have POI do demonstrate some or other immune pathology or autoimmune condition. So something that would be relevant to day-to-day POI clinical situation.
Indeed. So I think the key question is how do we screen and what sort of autoimmune conditions we're expecting to see. So we have a very interesting paper by Savu Kuskiv and others from Finland, and in this exercise they conducted a retrospective population-based cohort study. We all know that in Scandinavian countries, the population health records are fantastic, and they gather routinely very high quality health data. And so in this exercise, what they did is they collected data on women with a diagnosis of POI from the index date being the first time that they were prescribed HRT, because these women, when they have POI less than 40, they're eligible to have prescriptions for HRT all the way up to the menopause age of 50. And then they compared these 3,972 women. They compared the diagnosis of autoimmune disorders to a matched cohort. They matched for age and municipality, basically where they are in Finland. And while I think this is good, I think there are other sort of factors and confounders that we need to match for in these situations, particularly as autoimmune disease is quite varied and nuanced, and it can manifest across different patients in different ways and with many sort of predisposing factors. Now, the interesting element is the incidence of POI, while it was the incidence of autoimmune disease, while it was slightly higher in women with POI at 10%, it's still relatively low, and in the reference cohort, it was 6.4%. That is during the whole study. So that is somewhat reassuring in that the incidence is slightly increased, but it's still not very prevalent. And when they looked into the type of different autoimmune disorders, they found that the most commonly diagnosed condition was polyglandular autoimmune disease with an odds ratio of 25.8, followed by Addison's disease with an odds ratio of 22.9, and then by vasculitis, as well as a variation of other condition. Now, I'd appreciate your clinical reflection on this, Vikram, because I think while in clinical practice is commonly easy to screen for thyroid conditions and maybe diabetes and other sort of common health conditions, is not as straightforward to screen for Addison's and vasculitis. And what are your thoughts?
Yes, Basil. So the difficulty we have is how do we make use of the resources in the most cost-effective way? And of course, the lack of good screening tests for many of these conditions, the sensitivity and the specificity can be quite not up to the mark. So currently, for example, whenever somebody presents with POI, we tend to do an immune screen for three things. We look at thyroid autoantibodies, we look at ovarian autoantibodies, we look at adrenal antibodies. And again, they have their own problems in terms of the assays and the specificity and the sensitivity. But generally, one would say that the thyroid is the most common one and often indicates that these women will have hypothyroidism or thyroid problems at some point in their life. What we are not sure about is often how often to monitor the adrenal antibodies if they are positive. How often should an endocrinologist see these women because of risk of developing adrenal insufficiency? How should patients be monitoring themselves and where do they report? Similarly, with ovarian antibodies, we don't see any clinical relevance because even if you suppress these antibodies with immune agents, you don't always tend to get any advantage in terms of reactivation of ovarian activity.
Mhm.
So we have lots more to learn about. clinically how relevant these screening programs should be, how often we should screen. But I think the point that you mentioned is this proves that there is some autoimmunity going on in the background for many of the women who have immune related POI. So it's always important to keep the mind open. They may be susceptible to other autoimmune conditions, and keep a sort of low threshold for investigating if they start showing symptom signs of other immune pathologies.
Indeed, and I think it's particularly important to highlight the need for multidisciplinary care, because often these women, their first port of call is the GP, who might refer them to the gynecologist or to the menopause specialist for lack of periods. But I think it's very important to consider these autoimmune aspects, particularly not just at the diagnosis stage, but the surveillance stage. And we always advocate for regular screening and monitoring for these women with their GPs, from simple things like annual blood pressure measurements and thyroid function measurements, liver and kidney functions. But as we can see, some other conditions might transpire as they get older, whether or not they're using HRT. So I think this is helpful to guide and sort of the long-term surveillance for these women to try
Yes.
to help give them the best health outcome possible.
Yes. I mean, the beauty of this study was that its numbers are large for such severe, uncommon immune condition. Overall, the numbers are large. As you said, the registries from Scandinavia are really well maintained. And it's a big, long follow-up, up to 30 years, I think they've covered, trying to see the prevalence or incidence of immune conditions in POI. And the other beauty is, again, they mention at some point in their argument that it may be that for some of these women, the POI then reduces their estrogen levels. And we know that estrogen is linked to immune function. So once they lose their cyclical immune sort of changes that happen with regular periods and estrogen, it may be that itself predisposes them to having immune conditions like joint inflammatory conditions, rheumatoid arthritis. And there is some hint of that in other observational studies. So not only you can have a background immune problem that's causing the POI and the risk of all these conditions, but the POI itself may then expose them to more immune conditions in future. So that's something that's worth studying in future studies.
Indeed, indeed. So the pathway of causality is not very clear here, which is quite fascinating. So, thank you, Vikram, for these insights. So we'll keep put the link to the article in the comments below section. Please remember to send us your comments and requests for future questions relevant to the diagnosis and management of menopause. And see you in a future episode. Thank you very much.
Thank you.